say thank you to Dr. Ganapathy and the Apollo Group for the invitation to speak. I actually had fully intended to be there in person, but had some travel issues at the last minute that couldn't get resolved in time to get there. So really thankful to Kevin and the technical crew for putting this all together very quickly. I'm going to talk today about sort of what's transforming healthcare in the U.S. and then focus that on what we call connected health. Do you have the slides up? They're up?
Yes, sir.
Okay.
Yes, sir.
Good. Okay. So I have no disclosures. I work for the government. We're not allowed to have disclosures, apparently. But in the U.S., there's a lot of talk about how healthcare will transform. I don't think it's a matter of will. I think it's a matter of must. Today, where I guess the best numbers are from 2013, the U.S. was spending over $9,000 per person for every person in the U.S. for health care. That translates out to $2.9 trillion, or about 17.4% of our GDP. Those numbers continue to rise every year, and they rise at a rate higher than our inflation rate, which has been pretty flat for the past several years. So something clearly needs to be done to bend that cost curve. If the finance issues aren't enough, there's a lot of other things that are changing the priorities and will drive transformation. And the first is that people are beginning to actually embrace health as a personal attribute. Typically, people think health is something that you buy, or health care is something you go and get when you really need it. But really, the people are beginning to embrace this as a personal attribute. As the financing in our countries begin to change, more and more of that cost is being pushed back to the individual through high deductible plans and otherwise. And so more and more of the individuals are going to be weighing out-of-pocket costs as an important driver of what happens. I think one of the most important things happening is commoditization, and that's occurring at several levels in healthcare. I define a commodity as something that is widely available, is affordable, and that the person who's paying for it has choice. Many things in healthcare are becoming commoditized. We're seeing that in laboratory medicine, for instance, flu shots, and a lot of the over-counter treatments and care through urgent care centers, frankly. And this is becoming an important driver. Quality would be a given. If you can't provide a high-quality product, that you won't be in the market, and we're seeing this in a number of industries. Automobiles, I think, are a great example. I firmly believe that efficiency will really be the driver of things. Efficient systems are inherently high quality, they are inherently safe, and they are inherently cost effective. And one of the big changes has to do with health information, and individuals must own and manage all of their data. We envision a future where every individual has a unique data record that lives somewhere, that all their data goes to, and they control access. And so then the ability to process that, the ability to have trusted health information will be the new currency of healthcare. And then access will no longer be defined about whether or not you can get an appointment, and really be defined through patient engagement. Healthcare is becoming personalized. I think one of the best manifestations of this is a big project just announced by President Obama earlier this year called Precision Health. This is where we get more and more information about each individual, whether it's through genomics or through their personal preferences. And we can tailor therapies, we can tailor processes specifically to them. Now, I think it's really important to know that we're still going to practice evidence-based care, but that evidence is going to be based on the individual characteristics and not on population means, which we do now. It also means we can start to talk about quality for an N of 1 and not quality as a statistical function, and that includes providing both safe and prevention of harm. As we do this, then control shifts from the health systems to the individuals. And as individuals begin to own the entirety of their health information, they can truly take control of their health. Now, I mentioned a unique record, and that record would be agnostic to the source, where the information came. It would be all-inclusive, and whether that data is generated by providers or by individuals, patient-generated data, It doesn't matter. It doesn't matter if it came from a hospital or a doctor's office or an insurance company or an urgent care center. It would all go to one common record owned by that patient. And then, as I said, access shifts from being about appointments, from being about who individuals choose, to help support them through health promotion, prevention, and then supportive well-being, and then when they get ill or injured, how to navigate this complex system and make individualized healthcare decisions. So in the U.S., there are some key innovations driving healthcare. The big one in primary care is called the Patient-Centered Medical Home. In the Veterans Administration, we call it PACT, or Patient Aligned Care Teams. But I think the key thing here is it's not just about team care, but it's about moving healthcare from being about a series of encounters to being about sustained relationships. In order for that to really happen, we have to begin to talk about healthcare information as being both transactional and coherent, which means it has to be acquired through the workflow process, and as I mentioned, all go into one place, so it's transparent and available. We're getting away from the idea of electronic medical records and moving towards health management platforms that include not just a provider-patient record, but also patient interfaces and population health management tools and supports team-based care. And we're beginning to talk a lot about data, both big and small, big data being the ability to look across records, and small data being incorporating a lot of patient-derived data, not just about health, but about daily activities, including diet, location-like. And so really, when we talk about relationship-based care, this really is what we call connected health. And so that brings us to the topic today, which is connected health. And our definition of that connected health is not about technologies, it's about the sustaining the relationship between patient and the healthcare system beyond the traditional bricks and mortar walls. It actually takes healthcare and transcends the boundaries of both time and distance. And when we do that, we really begin to empower patients to be managers of their own health. The VA has been invested in health technology, telehealth technology, for going on a couple decades now almost. We actually trace our start back to 1984, which is when we started to do home monitoring of patients with implanted pacemakers using TTM technology, and we've moved forward through multiple different technologies since then. So we have telehealth services that include clinical video telehealth, home telehealth, store and forward, which includes things like teledermatology and teleretinal imaging. We have a huge emerging investment in mobile health with both patient-facing mobile apps and provider-facing apps and devices, as well as sort of an integrated text messaging system, which is called Annie. And we have My Healthy Vet, which is a portal that includes secure messaging. A thing that VA invented has been taken over by Health and Human Services called the Blue Button, which allows patients to download the entirety of the electronic record. Actually started off as an ASCII text file, it's now as an XML file, so it's even more portable. And we can do a number of other things, including refill tracking and the like. But I think the other thing is telehealth also includes the phone. And if you can't learn how to answer your phone, you're never going to be successful with all of these other things. That includes the smartphone and the dumb phone, but I think in the end, the smartphone really will be the technology that is sort of the primary healthcare technology of the future. In 2014, we provided 2.1 million episodes of care to over 700,000 veteran patients. The VA probably certainly has the largest footprint of telehealth in the U.S. and probably in the world. About a little less than half those patients live in rural areas, which means being able to connecting with them through other means saves them travel to medical centers. And I'm not going to go through this whole list, but I just want to point out that about 4,000 patients are set up for clinical video telehealth in their homes. These are mostly severely ill and injured veterans who are cared for by families and other caregivers. And the ability to have this technology keeps them in their homes. and keeps them out of institutions. We actually have a mobile app called the Clinic at Hand, which actually helps the caregivers in the management of their care. I'm not going to spend much time on this slide, but it just shows you know, the series of things that we have, and when we started doing them, the thing that I think is important to point out is this whole notion of EConsults. Scan Echo is a video consultation process, but by having these in play, it allows us to do specialty consults in a much faster time frame than if you had to schedule people to come in and see a specialist in place. So we literally can get consults done on the spot rather than through sort of a serial processing of appointments. And we have an app store now. So we have the VA mobile app store, and we have both patient-facing and provider-facing applications in there. The best example we have is an app that's been around for a while called the PTSD Coach, which has been very successful in helping veterans with even very severe PTSD manage their symptoms, and it's been widely recognized and received a number of awards. And we have enough data and enough time now that we can really show significant impact. So when we look at home telehealth, we have a significant reduction in bed days of care and hospital admissions, significant savings on an annual basis per patient. Video telemental health is one of the most successful things we've done. We've reduced acute psychiatric bed days of care by a little over a third. Highly successful. The patients actually love it because it takes a lot of their hassle out of the way of getting into the appointments. And a lot of the savings we have is actually from reducing travel. One of the benefits in the VA system is that we do pay for patients to travel to their appointments. And so every encounter that you can do through a telehealth thing can save significant travel costs. Many, when you get out into western states, have to travel long distances. And this slide just kind of shows the adoption going back to 2003 for the telemental health, and you can see a dramatic increase, and we expect in 2015 we'll be well over 350,000 encounters a year, and about 120,000 patients will be engaged at that point. So a couple of things. You know, I think the reality is that healthcare really is an information business. You know, 85-90% of what we do is purely information exchange. I'm a cardiologist. You know, we do other things, surgeons do other things, and we'll never get away from the need of those procedures, but most of what we do is the processing and distribution of information. That information is increasing, it's becoming increasingly complex. Most of it patients can't access, and when they can't understand it. And in fact, at least in the US, the current healthcare industry actually thrives on this notion of information asymmetry. But that information asymmetry is breaking down, and it's breaking down quickly because patients have access to things through other ways. So as patients begin to engage with us as partners in their care, we're focusing collectively on preventive health and chronic disease management. We focus on patient outcomes. And the patients themselves are beginning to demand convenient, local, and timely care. They're no longer willing to put up with our schedules. They want to be seen on their schedules, which is where connected health really comes to play. They demand complementary alternative therapies. They really want to understand what they're getting and why. And they demand readily available information and the ability to contribute to that data set on their own behalf. So what will healthcare of the future be? It is an information business, and more we need to move to both coherent and transactional aggregation of data, meaning we collect data through the workflow process. This really becomes a logistics and scale issue. We're expanding our data sets from a relatively limited focus of what we see in patients sitting in front of us to much broader sets of data, the big data and small data, and it's not all just coming from the electronic medical records. It's coming from purchasing habits and Fitbits and you know, a lot of continuous flow of information. Information asymmetry is being reduced and commoditization is accelerating. We're beginning to see the role of both artificial intelligence and crowdsourcing in healthcare decisions. You know, we've got in fact, next week, or 2 weeks, I'm going up to IBM to work with the Watson team to begin to really understand the role of what Watson can do in terms of making some coherence out of medical records. And so managing data and managing the exchange of information is really the new value proposition in healthcare. And Connected Health is the platform that's going to be required for that to occur. So in closing, I think the very simple statement is better information leads to better decisions, and that in turn leads to better health. And so I'll end there. Thank you for the opportunity to talk. Again, thanks to Dr. Ganapathy for the invitation, the Apollo Group, and again, thanks to the technical team for pulling this all together. I hope you have a great conference, and I hope this was helpful. And if there are questions from me, we'll have to figure out some way that you can get them to me and I can answer them for you. So again, thanks, and I appreciate the opportunity to talk.